Hello, everyone, and welcome to CLS Live, a live stream series presented by the publishers of Contact Lens Spectrum. I'm your new host, Dr. Ashley Tucker, and it is my pleasure and privilege to be a part of this amazing program. So, for the past several months, our previous hosts have been chatting with leaders in the world of contact lenses, finding out what's going on, what's hot topics, and listening to their perspectives and their insights on this topic. But for the next few months, we are going to change gears quite a bit and talk about something quite different but a very important topic, and that's DE&I, or diversity, equity, and inclusion. We will particularly talk about this topic as it pertains to our wonderful profession of optometry. It is really important that we all embrace the concepts of diversity and multiculturalism in optometric education and in the profession in order to provide a better education for our students and ultimately better care for our patients. So for this series, we'll discuss each component of DE&I, and this week we will tackle the big topic of diversity. So I am honored to introduce my first guest, Dr. Ruth Shoge. Dr. Shoge received her Doctor of Optometry degree from and completed a residency in pediatrics and vision therapy at the Pennsylvania College of Optometry, better known to us as PCO. She received her Master's of Public Health from Temple University with a concentration in social and behavioral science. During that time, she developed a special interest in diversity, equity, and inclusion initiatives, which includes addressing health disparity concerns through cultural competency training, recruitment and retention strategies, and curriculum reform. She is the immediate past chair of ASCO's Diversity and Cultural Competency Committee, DCC, so I cannot think of a better person to open up this discussion. Welcome, Dr. Shoge.
Thank you so much, Dr. Tucker. Please feel free to call me Ruth.
Okay, Ruth. So, Ruth, how about we just jump right in? So, let's just talk about diversity just in general and tell me why you think it's important that we discuss this topic as it pertains to optometry.
Yeah, great question. And again, thank you for having me on your program to talk about diversity in optometry. Before I answer that question, I want us to consider the word diversity and think about it in its broadest context, because diversity includes, people with disabilities, people, gender identities, age, race, ethnicity, and many, many other categories. And so the conversations that we do tend to have around diversity that have been most prominent in our field pertain to race and ethnicity, primarily because racial and ethnic disparities in healthcare generally and eye care specifically continue to be prolific and chronic. So we just want to make sure when we're using different terms, we're defining them up front. And again, a lot of the conversation that we have pertaining to diversity is around racial and ethnic diversity and the disparities that result from that. And so we've had to have these conversations, sometimes difficult conversations, because we have to be aware that there is a problem, first of all, that it exists. And from there, acquire the knowledge and the skills around what causes these disparities and what causes them to continue to persist, and then take action to reduce them. So, that is why we're having these conversations. That is why, institutions and organizations continue to have diversity leaders in their leadership, because we do have to keep having these conversations if we truly do want to make a change and improve the visual health of our communities.
I agree. So agree, Dr. Shoge. So from a previous conversation, or Ruth, from a previous conversation we had, I found this so fascinating, how you went into practice and 10 years later decided to go back and get your master's in public health. And I think your story on why is very important. Can you share that with us?
Yeah, so it's probably a little unusual for folks to go back to school. But I think I appreciated that process is because having worked for a number of years at PCO in the clinic, and being in a clinic that's majority Black. And then at that time in my career, I'd started to see more and more patients who were experiencing concussion or traumatic brain injury, and starting to see the inverse actually of this population. So it was no longer, a 90% Black population, but maybe 10%. And so I knew that in terms of risk factors, Black people still had the same kind of risks for concussion or traumatic brain injury. So then my question is, well, what is preventing them from coming in? Is it that they don't know that an eye doctor is part of their healthcare team? Do they not? Do they show up to their primary care doctor or to ER, depending on the severity of the incident? And are they not being referred to an eye care specialist? Um, the what for me, I wanted to better understand what were the barriers and the facilitators that were preventing or promoting people to come in for vision care after concussion and TBI. So that was really the central question
Mm-hmm.
that I had going into the master's program. And completing this degree really got me to think more broadly about vulnerable populations generally and what it could look like to improve the care in those populations, and the responsibility that we have as clinicians to improve that kind of access. So it was important for me to better have a better understanding of the patient aspect of healthcare, not just the doctor top down aspect
Mm-hmm.
of healthcare. So that's what um, got me back into school 10 years into working.
So did you ultimately uncover that these patients just didn't know that they could have access to care, or what was the disconnect there?
Yeah. So there are a lot of reasons, and part of what's important about being a lifelong learner is just at that point in time, even just learning kind of the common language in public health that doesn't always trickle down into clinical care, such as social determinants of health and understanding what it means to have access or not have access and the spectrum that could take. So better understanding that obviously education is a big part of it, but do they have eye care benefits? That's a big part of it as well. Is there a disconnect between the primary care doctor that they may see more regularly and them referring them to us? Are their symptoms taken seriously? Is there some discriminatory barrier there that's preventing that referral process? And what does the completion of a referral look like? So that's where, again, we start to look at how we do business and how we take care of people and the completion of that care, what that looks like. So it's not a single answer
As we would
as
like for it to be, right?
it's multifactorial, and it's just
Mhm.
understanding the pinpoints of where we can start to influence that process.
Got it. So maybe let's switch gears a little bit to optometric education. So you are the immediate past chair of ASCO's Diversity and Cultural Competency Committee, which promotes racial and ethnic diversity and inclusion initiatives at optometric institutions. So why do you think it's important to have a committee like this? We all know it's important, but from your perspective, what can you share with us?
Yeah, my time on the DCCC was very formative for me, and I'm grateful for the experience that I had and for the committee and for ASCO for trusting me to lead in this capacity. So I'll forever be grateful for that experience. But it's important to have a committee like this in this particular organization, as well as all organizations and institutions, because it really keeps these issues at the forefront of everyone's minds and on the agenda and ingrained into the different initiatives that an organization may have. And so, people are busy. I can't deny that. Like sometimes you don't have time to make space on your plate for yet something else, even though you
Mhm.
might recognize it's super important. But if you at least maybe have a person, it should be a team, just to say that, so a team of people that can at least steer that ship in terms of, great, we want to think about adding this initiative to our school. How does it address diversity? How does it make sure it's equitable? How do we make sure we're including people in these different initiatives? And being able to constantly have that at the forefront of the conversations is super important, because it's just easy to, unfortunately, um, attend to other things,
Mhm.
many things that we all have to do every day. So I think having a team in place that can continue to facilitate these conversations, the changes in an organization is super important.
Absolutely. Can you share any positive changes that came out of your tenure as the chair?
Yeah, we did a lot of work that I'm proud of. We had different conversations. We hosted several town halls during my time there. And that was just a place for our community members to ask questions that they might not otherwise feel comfortable asking in their organizations.
Mm.
Having panelists who could provide context and answer questions that I can't answer because I know the lane I'm in. I'm an optometrist, and now I do some of this DEI work. I can't necessarily speak on Supreme Court rulings, for example. So let me find a lawyer who can, who's also involved in DEI work. So helping to put together those conversations was um, really good experience. We've revised and update our cultural competency guidelines that all ASCO members have access to. And this again has a lot of clinical bearing in some of the skills and knowledge we should be acquiring as clinicians as well as educators to in order to take action to make sure that we are continuing to be lifelong learners in this area. Um, we created a platform where we can continue to provide materials for learners and educators and different videos and things. And we've had the opportunity at a couple of our academy meetings, American Academy of Optometry meetings, to have a keynote speaker in this area, both of which were very well attended. So we've did a lot of work in a short amount of time. Definitely still have some great people on the committee continuing that work, initiating new work, and I'm just really proud of what we've been able to do in the last few years when I was more of an active participant, but also this committee has been in existence for at least a couple of decades now.
Really? I
Yeah,
didn't realize that. Gosh.
yeah,
So
yeah.
a lot of progress has been made, right, with this topic, with the efforts, and a lot has changed since you and I have been in school. Excuse me. But I often wonder for myself: are there little things that practicing optometrists can do, or current students can do to help make this less of an issue, less of a topic that we need to be discussing quite frequently?
Yeah. That's a good question, and it's a um, it's a question that requires a lot of thought and thoughtfulness, I think, because I want people to feel engaged in this work without scaring them off,
Hmm.
because it is a all hands on deck um, um, kind of thing. I need students to keep asking questions and pushing the boundaries. A lot of the initiatives that we see in the academic areas because of students and because they speak up and because they say we want to have this as part of our education, and we as faculty and the leadership have to respond to that. um, People within our private practice, um, one should get to know the people within their practice a little bit more because we all have um, differing and diverse perspectives to add to our conversation and to how we interact with our patients, and also understand the community that you're serving, who has the greatest needs, and how you're able, as a practice, to meet those needs. And then sometimes it's in little ways. Are you able to do a school screening at your child's school? And just get the students and the parents and the teachers to understand the need for vision care. Are you able to see one Medicare patient, because we know the reimbursement is terrible, but can one a day or even one a week help reduce that need a little bit? What are ways that you can integrate into the community better in non-transactional ways, on volunteer basis, building that trust with that community. So there are a lot of things, and some things that folks may already be doing, and hopefully they recognize as that's them playing their part. But I think making sure that we're educating our community, we're educating future optometrists, and sparking that curiosity in your pediatric patients if you see them in your practice, and telling them and educating them about the great possibility of being an optometrist, because that's what's also going to help to close the gap a little bit with these healthcare disparities, is just having also more diverse doctors doing the exam. So there are a lot of different ways everybody can play a role in understanding what these disparities are, understanding the role of diversity in our profession, and helping to create a healthier community. So those are my three big goals doing this work.
Yes. Well, Dr. Shoge, that was fantastic. I appreciate your insights. I appreciate your efforts. I appreciate the efforts of the entire DCC committee. There, people like you are what are affecting change in our community and our profession, and I can't personally thank you enough. So I appreciate your time. We're going to wrap up. So that was a fantastic talk. Please join me next month when we continue the conversation. So at that time, we'll be focusing on inclusion and how this may pertain to patient access to higher level services like specialty contact lenses and myopia management. So I'm excited to bring part 2 of this series. So as a reminder, you can catch previous episodes of CLS Live on Contact Lens Spectrum's page on Facebook or on clspectrum.com, as well as transcripts of the show now in the printed version of Spectrum each month. Thanks again, and see you all next month for another episode of CLS Live. Bye-bye.